Do you know the signs of liver damage? They might not be what you expect. The liver, an organ that often doesn't get the attention it deserves, plays a crucial role in keeping our bodies healthy. It's our body's largest internal organ, acting as a powerhouse for detoxification, protein synthesis, and digestion. But like any other organ, it can get damaged. And the signs of liver damage? They're not always as obvious as you might think. In fact, there are 12 surprising signs of liver damage that many people unknowingly overlook. These signs can easily be mistaken for other health issues, which is why it's so important to know what to look for. Understanding these signs can help you take steps to protect your liver health before it's too late. So let's get started. Stay with us as we delve into these 12 signs that could indicate liver damage. To kick us off, the first sign of liver damage might surprise you. Your skin and eyes can become jaundiced or yellowish. Now you might be wondering, why does this happen? Well, the liver is like your body's personal detox center. It works hard to break down harmful substances, including a byproduct of red blood cell breakdown called bilirubin. When the liver is damaged, it can't process bilirubin effectively, leading to its buildup in the bloodstream. This excess bilirubin then deposits in the skin and eyes, giving them a yellowish hue. Jaundice is a clear signal that your liver isn't functioning as it should be. Moving on to the second sign, itchy skin. This might seem like a minor annoyance, but it could be your body telling you something isn't quite right. You see, a healthy liver filters toxins from your blood, but when it's damaged, these toxins may remain in your bloodstream and get deposited in your skin, causing itchiness. So if you're feeling itchy all over without any apparent cause, it might be more than just dry skin. It could be an indication of liver damage. Last in this section, but certainly not least, is abdominal pain. This can be a tricky one because abdominal discomfort can stem from a variety of causes. However, when it comes to liver damage, the pain is typically felt in the upper right part of your abdomen. That's because this is where your liver resides. The pain may vary from a dull ache to a sharp stab and is caused by inflammation or enlargement of the liver that stretches the organ's surrounding capsule. It's your body's way of saying, hey, something's wrong here. These are just the first 3 signs, but there are still 9 more to discuss. Moving on to the fourth sign, you may notice that you're feeling unusually tired. This isn't your everyday exhaustion. We're talking about chronic fatigue, a pervasive sense of tiredness that doesn't seem to get better with rest. This happens because your liver is working overtime to repair itself and to perform its many vital functions. Since it's such a multitasking organ, any damage can put a serious strain on your body's energy resources. Chronic fatigue is a telltale sign that your liver might be crying out for help. Let's journey on to the 5th sign, loss of appetite. Now we're not talking about skipping a meal because you're busy or not feeling particularly hungry one afternoon. We're talking about a consistent lack of desire to eat. This is because your liver plays a crucial role in the digestion process. When it's damaged, it struggles to process nutrients and fats, leading to feelings of fullness or a distaste for food. If you're losing weight without trying or find yourself not wanting to eat for extended periods, it could be a signal that your liver is under stress. Now, on to the 6th sign, nausea. This unpleasant sensation can be a symptom of many things, but when it comes to liver health, it's particularly significant. Your liver is responsible for removing toxins from your body. If it's not performing optimally, these toxins can build up and cause feelings of nausea or even vomiting. It's your body's way of telling you that something's not quite right. These signs, chronic fatigue, loss of appetite, and nausea, are all ways your body tries to alert you that your liver might be in distress. They might seem general at first or even be mistaken for other conditions. But if you notice a combination of these symptoms, it's important to heed their warning and seek medical advice. We're halfway through our list. Let's continue to the next set of signs. The 7th sign is a change in the color of your urine and stool. It's not exactly the most pleasant topic, but it's one we can't afford to ignore when discussing liver health. Dark urine can indicate that your liver isn't doing its job of filtering toxins from your body correctly. Instead, these toxins are finding their way into your urine, giving it a darker hue. So if you start to notice a consistent change in the color of your urine, it might be a sign that your liver isn't operating at full capacity. Now let's talk about pale stools. The color of your stool can also provide crucial information about your liver's health. Your liver produces a substance called bile, which aids in the digestion of fats. When your liver is damaged, it may not produce enough bile, leading to stools that are lighter in color. It's not about panicking at the first sign of a lighter stool, but if you notice a persistent change, it's worth getting checked out. The ninth sign is easy bruising. A healthy liver produces proteins necessary for blood clotting. If your liver is damaged, it may not be able to produce these proteins in adequate amounts. As a result, you might find that you bruise more easily than usual. A simple bump that would normally leave no mark might result in a bruise. This is because your blood isn't clotting as well as it should be due to a lack of necessary proteins. These signs can seem subtle, and you might be tempted to brush them off as nothing serious. However, they could be your body's way of signaling that your liver is in distress. It's always better to err on the side of caution. If you notice any of these signs persisting, it's worth having a chat with your healthcare provider to rule out any potential problems. We've now covered 9 signs. Let's move on to the final 3. Next up, the 10th sign is experiencing swelling in the legs and ankles. When your liver isn't functioning properly, it can lead to a condition known as edema, which causes fluid to build up in your body. This often results in swelling, particularly in the lower extremities. It's not just an uncomfortable symptom, it's a clear signal that your liver might be struggling to do its job. If you notice this kind of swelling, it's important to seek medical attention promptly. Now let's move on to the 11th sign, which is mental confusion. You might be wondering, how can my liver affect my mind? Well, when your liver is damaged, it has a harder time removing toxins from your blood. These toxins can then build up and eventually reach your brain. This can lead to a condition called hepatic encephalopathy, which can cause mental confusion, forgetfulness, and difficulty concentrating. It's a serious symptom that requires immediate medical attention. Lastly, we come to the 12th sign, weight loss. This may seem counterintuitive given the swelling we just discussed, but unexplained and sudden weight loss can be a sign of liver damage. When your liver is under stress, it can affect your appetite, leading to decreased food intake. Additionally, liver disease can cause malabsorption, where your body is unable to properly absorb the nutrients from the food you eat. This can result in significant weight loss over time. All these signs are red flags that should not be ignored. They indicate that your liver, an organ vital to your overall health, might be in trouble. Remember, early detection is key in managing liver disease. So, if you notice any of these signs, don't hesitate to consult with a healthcare professional. That wraps up our list of 12 signs that could indicate liver damage. Take care of your liver, folks. It's the only one you have, and it plays a critical role in keeping you healthy. To recap, liver damage can present itself in a variety of ways. From the subtle, like experiencing fatigue or a decrease in appetite, to the more noticeable, like jaundice or swelling in the abdomen. We've explored 12 possible signs, each a potential red flag that your liver may be crying out for help. It's essential to remember that these signs can be easily overlooked or mistaken for less serious conditions. So when your body is sending you these signals, it's crucial to listen and take action. The liver plays an indispensable role in your overall health, and neglecting its cries for help could lead to severe complications in the future. Your health is not something to gamble with. So if you're experiencing any of these signs, don't hesitate to seek medical attention. Early detection can make a world of difference in treatment and recovery. Remember, your health is important. Don't ignore these signs. Consult with your doctor if you notice any of these symptoms. Thank you for watching, and take care of your liver.